Hello, you are most welcome, ladies and gentlemen, to today's tutorial. Today we want to continue our journey looking at muscles of the lower limb. We already seen muscles in the thigh region where they are organized into three: anterior group, medial group, and then the posterior group, which are actually separated by the intermuscular septa. Now for the leg region, just like we have in the thigh region, they also organize into three groups, but this time around we have the anterior group, we have the lateral group, and we have the posterior group. Now the posterior group is quite bulkier, so when you take a transverse section, that's the place where you have a lot of muscles being there. So without much ado, yes, let's go through this leg muscles. So I'll begin with the muscles in the anterior group of the leg. Now they are generally called the extensors. Now if you remember the video that I've done on the upper limb, okay, what we find is that yes, in the anterior compartment of the forearm we had actually flexors, and in the posterior compartment of the forearm we had extensors. Now it's exactly opposite to what we have in the leg region. For the leg region, in the anterior compartment of the leg we are going to have what we call extensors, and then in the posterior compartment we will have flexors. It tells us that yes, in the anterior compartment of the leg we are going to have what we call flexor retinaculum. We are going to have extensor retinaculum, and then of course in the posterior compartment of the leg we will have what we call flexor retinaculum. Now if we are talking about extension, what happens is that it's actually what we call dorsiflexion. I'm going to show you pictures in this regard, but get to know that generally the muscles in the anterior compartment of the thigh of the leg will actually, apart from helping in what we call dorsiflexion, also aid in something we call inversion of the foot. I'm going to show you all these ones, and then they will be supplied by what we call the deep peroneal nerve. Now what we get to know is that yes, we have what we call the sciatic nerve. The sciatic nerve will divide into what we call a tibial branch and then a common peroneal branch. Now the common peroneal branch will actually, after wrapping around the neck of the fibula, will branch into what we call the deep and then the superficial branch. Now of course the superficial branch, which you'll get to see, it will supply muscles in the lateral compartment of the leg. Then the deep group, okay, will actually supply what we call muscles in the anterior compartment of the leg. Again, with respect to blood supply, of course, it will be by what we call the anterior tibial artery. So without much ado, yes, let's go through this. Now, so just by way of knowing some movement that goes through the foot. Now, because we are talking about muscles in the anterior compartment, okay, of the leg, they are going to help in what we call dorsiflexion. So that what happens that the toes are actually points upwards, okay. That is what we are going to see over here at the ankle joint, and then in the dorsiflex position, there's a dorsiflex. Now opposite is the plantar flex position, plantar flexion, okay, bringing the toes, actually pointing them downwards as if you are doing tiptoeing. Now I told you that yes, apart from helping in dorsiflexion, the muscles in the anterior compartment of the leg will help in what we call inversion of the foot. So that essentially what happens is that the medial border of the foot, okay, is turned inwards. Okay, so that's what happens. You raise the foot so that it turns inwards, or it turns closer to the midline of the body. Now opposite to that, okay, turning the sole of the foot laterally, okay, or outwards, is where we call eversion. Now we get to know that this eversion will be performed by what we call the muscles in the lateral compartment of the leg region. So apart from these foot movements, we are also going to see there will be some other muscles which is in this compartment which are going to help in what we call extension, okay, of the toes. So when you raise the toes, such that they point upwards, then you have extended them. Then opposite, when they point downwards, that is the flexed position of the toes. So let's actually go through these muscles. Now in the anterior compartment of the leg, we are going to have 4 muscles. Well, some individuals may present with 3, because they won't have this muscle known as, peroneus tertius muscle. Now I've told you that the word fibularis, okay, is synonymous to peroneus. Now usually I'll be making mention of peroneus, so if you hear peroneus, then it has to do with fibularis. Now this is one of those muscles in the anterior leg compartment, and it's known as tibialis anterior. Of course, the name tells us it's going to run on the anterior surface of the tibia. Now we have a counterpart of this muscle, we call it tibialis posterior, which will be part of the posterior compartment of the leg. Now get to know that the tibialis anterior, yes, is actually the longest, okay, in the anterior compartment of the leg, okay, so that, yes, it will actually originate from the lateral surface of the tibia, okay, actually over here, and then it will run, yes, on the lateral aspect of what we call the tibia, as well as, yes, in the shaft, anterior shaft of the fibula, okay, and then it will run all the way. Then it comes, can see that it is starting laterally, but it tendon runs on the medial aspect because it crosses, the lower aspects of the tibia, as well as, of course, the talus, and of course the various, the navicular bone, all the way to the medial cuneiform bone, and then it will insert on the base of, the first metatarsal, okay, it will insert on the base of the first metatarsal. By so doing, because it is also, yes, you can find it over here, some portions may also insert on the medial cuneiform. Now remember that the medial cuneiform is the largest, cuneiform, yes, of course the intermediate being the smallest anyway, okay, so it's inserting on the medial cuneiform. Right, now as I said, yes, these muscles, what they are going to do, they are going to help in what we call dorsiflexion of the foot. Okay, so please get to know. Now look at this long tendon over here. Sometimes it could rupture, and I will explain that one. Now the next muscle, which when I cut and reflect this tibialis anterior muscle, deep to it, I'm going to have this muscle, which is known as extensor digitorum longus. Extensor digitorum longus. Now if you remember, now when we talked about muscles in the posterior compartment of the forearm, we saw there was extensor digitorum. Now there was no brevis or longus or profundus or superficialis to it, but in the leg region, okay, we are having extensor digitorum, but this time around you add the surface longus to it. Now as I said, yes, it's going to be deep to tibialis anterior, and it will actually, yes, originate from the lateral, yes, condyle of the tibia, as well as, of course, yes, around the lower aspect of the head of the fibula, as well as the anterior shaft, okay, actually medially of the fibula, okay, and then, yes, of course, it's going to insert. Now as it comes here, look at this, as it runs downwards. Now this time around it runs almost vertically without crossing, as you can see over here, and then over here around the ankle joint area, its tendons split, okay, into four. And insert on the dorsal aspect, okay, so these areas are the dorsal. Now underside will be the plantar aspect, okay, so insert on the dorsal aspect of the hairs of the lateral four, okay, this from medial to lateral four of the middle phalanges of the toes, okay, so that's how it's going to insert. All right, now what happens is that, yes, because of how they split over here, you can actually palpate it over here, okay, so sometimes when you can actually feel someone's tendons of extensor digitorum longus, okay, it's actually coming from that one. And this one, yes, as the name suggests, they are going to help in what we call extension of the lateral four toes, yes, of course, they also will be relevant in helping in what we call dorsiflexion at the ankle joint, okay. So I've told you that all these muscles in the anterior compartment of the leg will be supplied by the deep branch of the common peroneal nerve. Now sometimes this one may be absent, okay. There is this muscle over here which actually blends with that of the extensor digitorum longus. So sometimes we even say that it's just, coming from, extensor digitorum longus only. But of course, we call it fibularis or peroneus tertius muscle. Peroneus tertius muscle. So the peroneus tertius muscle, yes, will actually, it will actually arise from a distal third, okay, distal third or distal 1/3 of the anterior surface of the fibula, okay, as you can see, surface of the fibula, and then of course it will blend with that of, the extensor digitorum longus. But this time around, yes, of course, it will also, come all the way to insert on the base of the the dorsal aspect of the fifth metatarsal. So this peroneus, tertius muscle, yes, will be important in what we call dorsiflexion of the foot. It will help in that regard. Then it will also contribute to what we call eversion of the foot. Now I told you that now these muscles in the anterior compartment of the leg will help in what we call inversion of the foot, so that the medial border or the sole of the foot actually, yes, orient inwards, or internally orients inwards. Now what we are saying is that the lateral muscles of the lateral compartment of the leg will help in eversion of the foot, so that the sole of the foot is actually turns outwards or laterally, okay. But in addition, this peroneus tertius muscle will also contribute to eversion of the foot, because of course it is inserting on the dorsal aspect of the fifth base of the fifth metatarsal. Now if I reflect this extensor digitorum longus, then I'm going to get this deep muscle known as extensor hallucis longus. So get to know that extensor hallucis longus. Now the word hallux has to do with the great toe. So it tells us that it's going to insert on the great toe. So the name is extensor, going to help extend hallucis longus. Now anytime you hear the word longus or brevis, then it means there's a counterpart. Okay, so when we look at the intrinsic muscles of the foot, we get to know that there will also be what extensor, hallucis brevis. Now this time around, because it's coming from the forearm, from a longer, origin, then we'll have a high origin. Then what will happen is that we call it extensor hallucis longus. Extensor hallucis longus. Now this muscle, yes, will actually, yes, run medial. Okay, will run on a medial surface, okay, of the lower shafts, okay, of the fibula, okay, this way. And then look at its tendon. Its tendon also moves to, fibula is laterally placed, so moves all the way, because the great toe is actually located medially, okay. So its tendon, yes, runs in front of the knee joint, okay, to eventually insert on the base of the first, it will insert onto the base of the distal phalanx, actually the distal phalanx, okay. This is the proximal phalanx, intermediate and distal phalanx, the base of the distal phalanx of the hallux, okay. So that's the great toe. So it will be relevant in actually extension of the great toe. So if we are able to extend your great toe, then it's by the concavity of extensor hallucis longus. Then of course it will also help in what we call dorsiflexion, as generally these muscles in the anterior leg compartment are going to do. So that is what we want to actually see. Now I told you that, yes, unlike in the forearm where we had in the extensor group, which was actually located in the posterior aspect of the wrist area, okay, of the forearm. Now the flexors over here are located in the anterior aspect of the leg, and therefore, because we are calling them extensors, then we're also going to have extensor retinaculum. So you can see that this is actually the superior part, okay, this is the inferior part. So we have extensor retinaculum. Now this extensor retinaculum, yes, is actually a broad ligamentous sheet, okay, that we are going to find it in the ankle joint area, okay, in the ankle area. And as I said, it's going to have two parts, superior part and an inferior part. Now actually the superior part will originate from the distal aspect, okay, of the fibula. Now get to know that there's a lateral aspect, posterior, there's the anterior aspect, there's a lateral aspect, okay, and then you get this way, there's the, you know, medial aspect. So actually this superior, you know, band of what we call the extensor retinaculum will actually, yes, originate from the anterior part of the distal shaft, you know, of, you know, the fibula, okay, and it will run all the way this way to actually insert on the anterior aspect of the distal part of the tibia. So that's the attachment from the anterior aspect lower part of the fibula to the anterior aspect lower part of, you know, the tibia. Now, so you can see that, yes, this time around we can see some tendons actually running deep to it, and these tendons are tendons of muscles of the anterior compartment of, you know, the leg. So as you can see over here, okay, I mean this muscle is the tibialis anterior muscle. Now get to know that these muscles, okay, to minimize friction, they're actually, you know, surrounded by tendon sheets, okay, with synovial fluid in it to minimize tension over here. So this is the tibialis anterior muscle, it's synovial sheet over here. And then of course we're also going to have extensor, you know, look at this one. There's the extensor digitorum longus with a tendon sheet. All right, now this one will be the extensor hallucis longus. Okay, getting to the grade 2, extensor hallucis, you know, longus. So I mean that is what I mean actually we are going to see over here. So you know, that is that one for you. Now you get to know that. Now look at this one, we call it usually, you know, we will call it, you know, the peroneal or the fibular, you know, retinaculum, because we are going to have the peroneus longus and brevis, you know, muscles actually running deep to it, which we will get to. Okay, so this is actually the inferior band of the extensor retinaculum. Now you get to see that this one is actually Y-shaped. Okay, it's actually Y-shaped, you know, and it's actually, yes, originating from actually the lateral aspect of the calcaneus, and then it will actually, yes, bifurcate, okay, with its lower, I mean, fibers or lower, you know, band actually blending with what we call the plantar aponeurosis or the plantar fascia. We will actually look at that one. And then, you know, this one actually will actually insert, okay, onto what we call the medial malleolus. Okay, now this is actually the lateral malleolus because related to the fibula. Now medial malleolus will be related to the tibia, so that's where it's going to. Then of course, you know, running deep to the, you know, extensor retinaculum will actually be, as you can see, the tendon sheets of, you know, extensor digitorum, okay, dividing into those 4 tendons. Then of course, you know, we are going to have extensor hallucis longus. Then of course we are going to have tibialis, you know, anterior, I mean, tendon also running deep to it. But get to know that, yes, even apart from these tendons, what will happen is that, yes, we will have the, I mean, anterior tibial artery, yes, as well as, you know, the deep branch of the common peroneal nerve also running deep, because we said that these muscles will be supplied by these neurovascular structures. Then of course, running deep to this one, okay, you can see this yellow color structure over here, okay, that's extension of the deep branch of the tibialis, of the, you know, deep branch of the common peroneal nerve, the terminal branch actually. Then of course, you know, above it, this red color structure over here, yes, will be the dorsalis pedis artery. Very soon I'll go through the, you know, vasculature, okay, the blood supply to the lower limb, yet to actually understand all these ones, the dynamics, as we go through it. So I mean that is that one for you. Now we said that the muscles in the anterior compartment of the leg are dorsiflexors, or they are extensors. Okay, so they are going to help actually raise, okay, your toes or your foot upwards. But if for some reason, if there is injury to the nerve that supplies these muscles, being the deep branch of the common peroneal nerve, then what will happen is that because of the unopposed action, now we said that in the posterior compartment of the leg, we are going to have what we call the plantar flexors. So if the plantar flexors are working, and what will happen is that the dorsiflexors, because the nerve supply to them, there's injury to it, and the muscles become weak, and therefore you can't actually what you call dorsiflex. Now what happens is that the common peroneal nerve actually moves around the neck of the fibula. So if there's fracture in the neck of the fibula, then it could cause injury to the common peroneal nerve. And we say common peroneal nerve will give rise to a deep branch and as well as the superficial branch. Therefore, it tells us that yes, we won't be able to actually, dorsiflex. And that is the injury to what we call the, common peroneal nerve, which will actually result in foot drop. So classical sign that you are going to find with someone who presents with injury to common peroneal nerve will be foot drop. But interestingly, some people are able to, circumvent this one. They're able to find some way out by actually doing what we call flicking. Okay, they will flick their, foot outwards, okay, while they walk, and that is what we call eversion flick. So, I mean, that is one thing that we have to appreciate regarding, these muscles. Now, I told you that we should take notice of, the tendon of the tibialis anterior muscle. Okay, now sometimes there could be a tear to the tendon of the tibialis anterior, okay, over here. So that what will happen is that yes, I mean, you won't be able to actually powerfully, because it's a major, dorsiflexor. So what will happen is that if there's a force, opposing force to the foot, okay, this way, then what will happen is that, okay, we will test if there's one is ruptured or not by actually placing an opposing force to what we call your foot. So if the patient is, having an intact, okay, tibialis anterior, then the patient is able to powerfully overcome the load, okay, or the opposing force, and actually do what we call dorsiflexion. Now, if there is rupture, okay, there's tear in what we call the tendon of tibialis anterior, then it means that if the opposing force, okay, is placed on the foot, what happens is that the patient will not be able to dorsiflex. And that's what we are able to tell that, and usually we are going to see that kind of gap over here created over here, and it tells us that yes, there is tear to the tendon of tibialis anterior muscle. All right, so we actually want to look at muscles in the lateral compartment of the leg region. We've seen muscles in the anterior compartment of the leg, and we said that there are 4, or some people could be 3. In about 10 to about 20% of the cases it could be 3, because peroneus tertius may be absent. So of course, constant ones will be tibialis anterior, yes, will be extensor digitorum longus, as well as extensor hallucis longus. So for the lateral compartment, there are just 2, okay, and they are the peroneal longus and brevis. Now what happens is that yes, they are going to be very important in actually what we call eversion of the foot, with support coming from peroneus tertius, which I've already explained. Okay, so in eversion of the foot, I've explained that that's where the soles of the foot will be turned outwards or laterally. Now these ones, after the common peroneal nerve has bifurcated, okay, will give rise to a deep branch. The superficial branch, okay, will actually supply this group. Okay, they will actually supply this group. So that is what we have to actually appreciate. So there we are. Here we have the peroneus longus or fibularis longus, and we have the peroneus brevis or the fibularis brevis. So as you can see over here, yes, this is the peroneus longus. The peroneus longus muscle will actually originate from what we call the superolateral aspect of actually the tibia, okay, the lateral tibial condyle area, as well as the head of the fibula, okay, laterally, and then it will run almost inferiorly, running deep to what we call the superior and of course inferior fibula retinacula, okay, or of course the calcaneofibular, ligament, okay, running deep to it, and then okay, running actually on the underside, okay, underside of the foot. So it's actually going to run deep, okay, to what we call, the metatarsals, okay, metatarsals, and then it will actually, yes, insert all the way onto the base of, the fifth, sorry, of, the first, metatarsal, base of the first metatarsal, okay, base of the first metatarsal. But in so doing, it's also going to have another important attachment. It also attached to what we call the medial cuneiform, although we can't appreciate it so much here, but it will have two insertions, the medial cuneiform as well as the base of, the fifth metatarsal, base of the fifth metatarsal. So that's how, it's going to run all the way crossing the various, metatarsals to insert on the base of the first metatarsal, as well as, to the medial cuneiform bone. Okay, so that is what we are going to actually see here. Now, this one is the larger muscle and it's even more superficial. So when I cut and reflect this, okay, running deep to it, actually the lower shaft of the fibula will be the peroneus brevis muscle. Okay, peroneus brevis muscle. It will also run, yes, deep to what we call the superior and inferior peroneal, ligament, retinacular actually, yes, and it will run to actually insert on the base of, the fifth, metatarsal. Okay, so it will run all the way to insert, in that manner, base. Actually, now this is the first, sorry, yeah, to the base of the fifth, metatarsal. Okay, to the base of the fifth metatarsal. All right, so that is actually what we have for the peroneus brevis, muscle, peroneus brevis muscle. Now, as I've already indicated, yes, these two will actually help in what we call eversion of the foot. But in addition, the fibularis longus may also help in what we call plantar flexion. So plantar flexion, yes, which is actually going to be performed by what you call the muscles of the posterior compartment of the leg, could be augmented by the fibularis, longus muscle. So I move on to the next compartment. That's the posterior compartment of the leg, and this is going to be, the flexors. Okay, the flexors, or they are going to help in what we call plantar flexion. Now over here we are going to have actually 7 muscles over here. 3 of them are superficial and 4 of them are described as deep muscles, okay, and they will be separated by what we call a band of fascia. Okay, so as I told you, this posterior compartment, because we have superficial and deep, that's the bulkiest, yes, compartment that we are going to find, so that in transverse sections you can actually appreciate these muscles very well. Okay, now these muscles, as I said, they are going to help in what we call plantar flexion. Yes, apart from even helping in plantar flexion, they may help in what we call foot inversion of the foot. Now we've seen that anterior compartment are going to help in foot inversion. Some muscles in the posterior compartment are also going to help in inversion of the foot. Now remember that these muscles will actually be supplied by what we call the tibial branch of the sciatic nerve. Please get to understand that, the tibial branch of the sciatic nerve. Now, to begin with muscles in the posterior compartment, one thing that we have to know is that the superficial 3 muscles, which we say they are superficial muscles, will have actually a common tendon, a common insertion point. These 3 muscles are all going to insert on the posterior aspect of the calcaneal bone via what we call the calcaneal tendon. Now this calcaneal tendon can also be referred to as the heel cord. Okay, this is the heel area, so the tendon over here, we also call it the heel cord. Now get to appreciate that we also call this tendon the Achilles tendon. Okay, Achilles tendon. And the reason is that, yes, in ancient Greek there was this, figure whose name is actually, yes, Achilles. And Achilles was a very strong guy. In fact, he was not vulnerable. Okay, you can't actually beat him or kill him through any other place, because the mother had actually given him a bath in one river called River Styx. Okay, so that, he's not vulnerable. But interestingly, there was only one area for which he was vulnerable. Okay, could be killed in this area. So I'm sure he was killed in, around this tendon. So this was the only area which he was vulnerable to. Okay, that's the Achilles tendon, that's the calcaneal tendon, and therefore its name. Now again, this tendon, yes, there could be friction around this area, because of course almost all the time we are moving, we are doing, plantar flexion and all that. Now what will happen is that, yes, there should be some synovial fluid filled sacs known as bursae to help minimize these friction that we are going to actually see over here. Okay, so there are actually two of these ones. One is subcutaneous. Okay, so this one, that's the subcutaneous bursa, which is actually found between the skin, okay, around the posterior area of the heel, and of course the Achilles or the calcaneal tendon. And then there is another one which is deep, okay, deep to it, and this deep one is finding itself actually between the Achilles tendon and the calcaneal bone, and that's what we call the retrocalcaneal bursa, because it's going to find itself behind the calcaneal bone. Okay, retrocalcaneal bursa, or it's going to find itself behind the calcaneal tendon, behind the calcaneal tendon. So that's these two main bursae which are going to help minimize friction in the posterior ankle area. Now these three muscles, now the most superficial of these three superficial muscles in the posterior leg compartment is the gastrocnemius. Now the word gastro has to do with belly or stomach, so it's going to have, is actually the stomach of the posterior leg compartment, so we call it gastrocnemius. Now this gastrocnemius, yes, is having actually two hairs, and for that matter two origins. Okay, you can see it's having two hairs. So where the medial malleolus is, okay, so this is actually medial and this is lateral. So there's going to be a medial head and it's going to be a lateral head, together joining to form a common belly, and of course inserting into the calcaneal bone via the Achilles tendon. So actually the medial head will actually originate from what we call the medial condyle of the tibia. Okay, to actually originate from medial condyle, of the femur. Okay, medial condyle of the femur. Okay, and also just above that condyle area, that's where it's going to actually originate. Okay, medial condyle of the femur. Then the lateral one, yes, will originate from the lateral condyle of the femur. Okay, as well as just above the lateral condyle area, just above that area. So but mainly you are going to have their origin from the medial condyle of the femur, as well as the lateral condyle of the femur, and then they will join to form a common belly to actually insert into the calcaneal bone via what we call the Achilles tendon, via the Achilles tendon. Okay, so that is what we are going to see over there. As I told you, if we take a transverse section, there is going to be the most superficial muscle. Okay, the most superficial muscle, and it's going to help in what we call plantar flexion, as we've already indicated, and it may also assist in some flexion at the ankle joint, Okay, so that's one for you. Now when I cut and reflect this muscle, okay, then I'm going to see majority, okay, of this muscle. This muscle is actually a very small muscle, okay, which we call it plantaris muscle. Now the reason why we call it plantaris muscle is that, yes, in most mammals, you are going to have its insertion into what we call the plantar aponeurosis. Okay, so if you look at the plantar aspect of the foot, okay, there's a thickened fascia over there known as plantar aponeurosis. But surprisingly, in humans, we don't have this muscle inserted in the plantar aponeurosis, but we still call it plantaris, muscle. Now, this plantaris muscle, yes, as you can see, is going to actually originate from, this actually the medial aspect. Okay, so it's originating from the lateral, supracondylar ridge of, the femur. Okay, laterally, and it will run. Look at how its tendon is running. Okay, running, somewhat medially. Now, actually, this muscle is having the longest, tendon in the human body. Although the muscle belly or the fleshy muscle is small, its tendon is very long. And as I said, all the superficial muscles are inserting into the calcaneal bone via the Achilles tendon. Now, get to appreciate that because its tendon is very long. Now, some people may actually confuse it to be a tendon, and that is why we call it the freshman, tendon. So if you are, a health worker, you have to go through, some schooling. So for instance, if you are, a student at the medical school for your first time, you may think that yes, of course, this is a tendon because of how long it is. But actually, yes, in the medial aspect, okay, running medially, okay, from the posterior region, there is no nerve over there. Okay, there's no long nerve over there for you to confuse it with it. This is actually a tendon, okay, of the plantaris muscle. Okay, so this muscle, although it's not very important, I mean, it's weakly assists in some plantar flexion, okay, at the ankle joint, and also helping in what you call flexion, at the knee joint. Now, get to know that because it's quite weak in its action, it may be absent in about 10 to 20% of the population. So roughly 90 to 80% of the population will have this muscle. Now, get to know that now superficial to this one will be the the gastrocnemius, but also deep to this one, okay, I'll come back to this one, is actually what we call the soleus muscle. So it's actually in the superficial group. We will have the gastrocnemius, followed by the plantaris muscle, followed by what we call the soleus muscle, so that when we take a transverse section, we can actually appreciate all these things. Now, this muscle, I'll actually come to that's the popliteus. It's part of the deep muscles in the posterior compartment of the leg. So, I mean, that is what we are going to actually see. Now, this muscle, okay, which I'm saying is deep to what we call the plantaris muscle, is known as soleus, okay, this whole muscle. Remember that all these three superficial muscles will insert into the calcaneal bone via the Achilles tendon. So, I mean, the soleus, its name because, of course, it's going to originate from the soleal line. Okay, we are going to have the soleal line this way. It's going to originate from the soleal line. Then, of course, we're also calling it soleus because of how flat it is. It resembles a fish, which we call it soleus. Okay, that fish is also flat, just like this one, so we also call it soleus. So this, I mean, soleus, yes, will be relevant, okay, in actually helping in plantar what do you call flexion, okay, to help in plantar flexion, just like all these muscles are going to do. Now, look at this. Now, because all these three superficial muscles insert onto the calcaneal bone via what we call the Achilles tendon, sometimes if there is too much stress on this tendon, I mean doing a lot of dorsiflexion, okay, you may suffer from tear to this Achilles tendon. Now, some people may also have chronic, I mean, inflammation of this tendon. So one or two reasons, yes, could be actually some infections. So that if there is frequent inflammation to this what we call Achilles, I mean the tendon over the Achilles tendon, then what will happen is that yes, I mean the person may be prone to rupturing of this calcaneal tendon. Now it tells us that if this tendon ruptures, then you can actually do plantar flexion. Okay, so the only advice here is that if you want to do plantar flexion, you need to take your time and do it slowly. You don't need to suddenly or forcefully do it, otherwise it may result in tear of this tendon. When that happens, your foot may be in almost permanent dorsiflex position. And other things that you may see will be difficulty in walking, yes, of course, or tiptoeing, actually. And of course, when we feel it, there could be a gap over there. So that is what we are going to find over there. Now for the deep muscles, as I said, there are 4. Okay, these deep muscles, yes, we are going to see, we've seen one already. This is the popliteus muscle. Okay, now look at how the popliteus muscle actually runs. This popliteus muscle, yes, it's actually very superior. Okay, with respect to the deep muscles, it's quite superior. Okay, so that's the superior most muscle that you're going to find. Now the popliteus muscle, yes, will actually form the floor, which we will get to when we look at the popliteal fossa. It will actually contribute to the floor of the popliteal fossa. Now, yes, again, one other thing too is that because it's related to the ankle joint, there is a bursa over there, okay, which we call the popliteal bursa, which sometimes can become inflamed. Okay, that's what we call it, the Baker's cyst. Okay, we will look at that one now. So there's a bursa to actually minimize friction around this area. So it will originate from the lateral femoral condyle. Okay, lateral aspects of the femoral condyle. Okay, because this is actually the medial side. This is lateral aspect of the condyle of the femur. Okay, and as well as the posterior horn of the lateral meniscus of the knee. Okay, it will have that kind of origin, and then it will run inferomedially. Okay, it will run inferomedially, actually above the soleal line, to make its insertion. Okay, above the soleal line to make its insertion. So one key thing over here regarding this popliteus muscle is that, yes, it's going to be very important in the knee joint, by helping in lateral rotation, okay, of the femur on the tibia, okay, to help to unlock the knee, okay, to permit flexion. Now regarding this kind of unlocking and locking of the knee, then what happens is that in weight bearing position, okay, for instance in standing position, okay, it means that your tibia and the head which is supporting the tibia in weight bearing, what happens is that we say that if there is medial rotation of the femur, okay, in weight bearing position, we describe locking and unlocking of the of the knee with respect to the femur. Please get to know that in weight bearing position, we describe locking and unlocking of the femur, of the knee joint with respect to the femur. And what we say is that if there is medial rotation, okay, of the femur, that results in locking of the knee. On the other hand, if there is lateral rotation, okay, of the femur, okay, at the knee joint, then we say there is unlocking. So to help in this, it is by the courtesy of the popliteus muscle. Meanwhile, in the non-weight bearing position, we describe locking and unlocking of the knee joint with respect to the tibia and of course the fibula, the head of the fibula. Such that what happens is that if there is rather lateral rotation, now we saw that when there was medial rotation of the femur, it resulted in locking. Now this time around, locking of the knee will happen if there's lateral rotation of the tibia, as well as of course the head of the fibula. Okay, then it results in what we call locking. Okay, so please get to appreciate that. So it means that I can say that in a weight bearing position, locking will take place when there is medial rotation of the femur, or in a non-weight bearing position, locking will take place where there is lateral rotation of the tibia, of course, and the fibula. Then unlocking will take place where there is, lateral rotation of the femur, okay, in the weight bearing position, or in the non-weight bearing position where there is medial rotation of the tibia and fibula. So let's try and appreciate these things actually. So that's the popliteus muscle. Now, the other muscle which you can actually see over there, okay, which I'm going to look at, is the tibialis the tibialis posterior muscle. Now we've seen tibialis anterior muscle. Now look at it. Now we have what we call flexor digitorum longus, okay, more medial, okay, and then we also have flexor hallucis longus, a bit lateral, and then sandwiching between them is the tibialis posterior muscle. Okay, so tibialis posterior muscle therefore becomes actually the deepest muscle, okay, the deepest muscle. Now it is going to originate from actually between the tibia and the fibula we will have an interosseous membrane. So it will originate from actually the interosseous membrane as well as the posterior surface of the tibia and fibula, the shaft of the posterior surface of the tibia and fibula. Then of course it will insert. Now the tibialis posterior will have a great point of insertion, okay. It will actually insert on what we call the calcaneal bone via what we call the sustentaculum tali. Then it will also it will actually run along the foot, okay, run deep to what we call the tarsal bones as well as the metatarsals, and then make these insertions. So it is inserting on the calcaneal bone via what we call the sustentaculum tali. Then it will also insert on all the other remaining tarsal bones, of course, talus, calcaneum, we've mentioned it, cuboid, yes, navicular, and all the three cuneiforms, medial, yes, intermediate and lateral cuneiform bones. Then of course it will also insert onto the base of the second, third, and fourth metatarsals. So it tells us that the first and the fifth metatarsals, it doesn't have insertion points. Please get to know that it's having a very great point of insertion. Now remember that we didn't mention talus, which is the superior bone of the ankle area. Now talus doesn't have any tendon inserting on it. It may have some ligaments inserting, but with tendons of muscles, it doesn't have any. So get to know the tibialis posterior muscle, tibialis posterior muscle. So as you get to know, it will help in what we call plantar flexion, yes, of the foot, and it's very important in maintaining the medial longitudinal arch. Tibialis posterior is very important in maintaining the medial longitudinal arch. Apart from that, it will also help in inversion of the foot, So that is what we have to actually appreciate. Now the next muscle, okay, which this time around lying a bit superficial but medial to the tibialis posterior muscle, is known as flexor digitorum longus. Now one thing is that you can see this flexor hallucis longus. I told you that the posterior compartment are the flexors, anterior compartment are the extensors. So their preface, you will see that in the posterior compartment they will actually begin with flex, and the word longus tells us that in the foot there will be a short form of these muscles as brevis. Okay, so flexor digitorum longus, or actually yes, surprisingly it is smaller. You can see that to the digates we have several digates, and we have hallucis is for the great toe. So we expect that this one should have been larger, but interestingly flexor hallucis longus is larger than flexor digitorum longus. Okay, so you will see that the flexor digitorum longus will originate from actually the posterior medial aspect of the tibial surface. Okay, posterior medial aspect of the tibial surface, actually below the soleal line. Okay, it will actually run below the soleal line. Okay, so if there's a soleal line, it will actually originate below the soleal line. Okay, posterior medial surface of the tibia, because there's a lateral aspect, there's a medial aspect. So tibia is more medial, and then what happens is that yes, it's actually going to split. Its tendons will split in the plantar aspect of the foot to actually insert on the basis of the distal phalanges. These are distal phalanges of the gates, of course the lateral four digates, and that's the gates 2 all the way to 5, the basis of the distal phalanges of the lateral four digates. And of course, as the name suggests, flexor digitorum longus is going to help in flexion of the toes, the lateral four toes actually. Then we also have what we call, this one, that's a flexor hallucis longus, okay, which lies a bit, as you can see, it lies somewhat lateral to what we call the tibialis posterior muscle. And flexor hallucis longus, yes, will be important in actually flexing the grade 2. Okay, it will be important in flexing the grade 2, and it will originate from actually the posterior two tears of the fibula, posterior aspect of the fibula. So you can see that the flexor hallucis longus, although it's going to hallux, which is medial, it tended to turn medially anyway, but what happens is that it's originating on the lateral aspect. Okay, so that's what we have to appreciate. Flexor hallucis longus. So because fibula is more laterally placed, that's where it's going to actually originate from. And then it will actually insert into the plantar surface of the base of the distal phalanx. Okay, of the base of the distal phalanx of the grade 2. Okay, so that's what we are going to actually see. Get to know that the grade 2 is known as hallux, and that is what we mean. So that is that. Okay, what we have to actually appreciate regarding the muscles in the posterior compartment of the leg. Now I told you that because these are flexors, okay, their tendons will be kept in place with respect to what we call the flexor retinaculum, who is going to have attachments actually from the medial malleolus, okay, medial malleolus of the tibia, all the way to what we call the medial surface of what we call the calcaneal bone, okay, calcaneus. So that is what we have, the flexor retinaculum. So passing deep to it will be mainly these tendons, as well as some neurovascular structures also going through it. So actually from medial to lateral, okay, this way we are going to have the tendon of the tibialis tibialis posterior muscle. Okay, tibialis posterior muscle will actually be more medial, and then it will be followed by what we call the flexor digitorum longus, the tendon of flexor digitorum longus, and then behind that we are going to have the posterior tibial artery. Okay, because we said that yes, in the posterior compartment will be supplied mainly by the posterior tibial artery, then its nerve will follow. Okay, that's the posterior tibial nerve. Okay, posterior tibial nerve. Okay, that's the posterior tibial nerve, because this is actually the posterior aspect anyway. And then we are also going to have followed by what we call the the flexor hallucis longus, the tendon of flexor hallucis longus. So if they ask you to mention the contents or the structures that pass deep to flexor retinaculum, then you can mention all these structures, neurovascular structures together, mainly these tendons of the muscles of the posterior compartment of the leg. Now we've seen that yes, muscles of the anterior compartment especially, they will be supplied by what we call the deep branch of the common peroneal nerve. So if you want to test for just something small to show something, now if you want to actually look at the cutaneous supply of the common peroneal nerve, then what we say is that you have to palpate, Okay, now the dorsal aspect, okay, the upper portion of your foot. Okay, so if you scratch the patient around this area, the person should be able to feel it. If the person feels it, then it tells us that, of course, the common peroneal nerve, its cutaneous supply is intact. But I'm more interested in the motor supply of the common peroneal nerve by way of the deep branch of the common peroneal nerve, okay, helping in dorsiflexion, okay, muscles in the anterior compartment of the leg, so that I can actually dorsiflex, yes, the ankle as well as the toes. Okay, then we've also seen that the tibial nerve, which is a branch of the sciatic nerve, will help in what we call plantar flexion. Okay, plantar flexion by way of the motor innervation. Okay, should be able to plantar flex. So if we're able to do plantar flexion very well, then it tells us that your nerve, tibial nerve, is actually intact. Then for cutaneous sensation, there's the plantar surface. Okay, if you scratch around this area, the patient, or pinch around this area, this patient should be able to feel that one. Then it tells us that cutaneous, or the sensory supply by what we call the tibial nerve, is actually intact. Now, having seen the whole picture of the posterior compartment of the leg, and we also looked at muscles of the posterior compartment of the thigh, then it's very important that we describe this fossa, which is almost diamond shaped. Okay, almost diamond shaped area, which we call it popliteal fossa. Now I told you that in the anterior aspect we will call it actually the patellar area. Okay, this opposite aspect is the popliteal area. So the fossa over here is known as popliteal fossa. It tells us that structures in the posterior aspect of actually the knee, okay, will actually can come into the knee or leave the knee, okay, from through this area. So structure from the posterior aspect of the thigh, posterior aspect of the leg, can actually move in this manner across this area. Now, so actually over here I'm interested in explaining the boundaries, okay, to you. So we are going to have four main boundaries. You have a roof and we also have a floor. So for the boundaries, we have, there's the medial aspect and there's a lateral aspect. Now you can see there's a plantaris, it's moving medially, okay, moving medially, the tendon of the plantaris. So we will have what we call superomedial border, or the boundary. Superomedial boundary will be formed by this muscle that we've seen already, that's the semimembranosus, and then lying on it, okay, is the tendon of semitendinosus. So both semimembranosus and semitendinosus muscles are forming what we call the superomedial boundary. Superomedial boundary. Now for the superolateral boundary, it will be formed by what we call the long head of what we call the biceps femoris muscle. Long head of the biceps femoris muscle. Okay, so forming the superolateral boundary. Then for the infromedial boundary, okay, we are going to have the medial head of what we call the gastrocnemius muscle. Medial head of the gastrocnemius muscle. Then on the inferolateral boundary, will be bounded by what we call the lateral head of the gastrocnemius muscle together with the belly of the plantaris muscle. So giving us this diamond shaped area, which we call it popliteal fossa. Now with respect to the floor, okay, the floor, we are going to have the knee joint, because over there we will have on the underside we will have actually the knee joint capsule actually being there. Then we also have some portion of distal aspect of the femur, as well as some proximal portion of the tibia also being there. But importantly, the muscle which is going to form the floor, the bed of the popliteal fossa, is going to be the popliteus muscle. So that is one thing that we have to know regarding the floor. Now how about the roof? The roof, of course, we will have skin. Then we also have what we call popliteal fascia. Now remember that the popliteal fascia is very thick, it's inextensible, okay, and this fascia is actually continuous with the fascia lata, okay, which is inferior thickening of what we call the which gives rise to the iliotibial band. In fact, so the fascia lata thigh, fascia. This one will be continuous to it superiorly, and then we also have this kind of fascia known as fascia crucis, okay, inferiorly. So that is what we are going to see regarding. So with respect to the roof, the skin, and of course the fascia to what we call the popliteal fossa, popliteal fascia. And I'm saying that this fascia is actually inextensible. So that's very important that we appreciate for some clinical application that we will look at. Now, having seen the boundaries, we've seen the floor, the roof. Now, how about the content? Now, the content, yes, they represent the popliteal vessels together with that kind of some neurovascular, other neurovascular structures, common peroneal nerve, tibial nerve, which are branches of the sciatic nerve, So actually these structures, I'm going to arrange them. Okay, this is actually the medial aspect. Okay, lateral, this superior to inferior. Okay, so we are actually going to see that from medial to lateral, we are going to have the popliteal artery. Sorry. Now, this popliteal artery, where is the red color structure over here, apart from being the medial most structure, it's also the deepest structure. Okay, the deepest structure, and then it will be followed by, of course, the popliteal vein. But you get to know that at the inferior aspect, this, there's the short, that's a short, saphenous vein. It actually drains into what we call the, popliteal vein. Okay, it actually drains into what we call the popliteal vein by actually running, in between the two hairs of the gastrocnemius muscle, to drain into it. Okay, then beyond that, we're going to have the tibial nerve. Okay, will also be there, and then a bit laterally, okay, we are also going to have the common peroneal nerve. So these are how the structures are arranged in what we call the popliteal fossa. But of course, also get to know that there will be some lymphatics also being there as well. Okay, there could be some other some lymphatics, okay, being there as well, together with, of course, some lymph nodes, okay, also being there. Now, to end with this, now the content in the popliteal fossa, which we saw, which is the popliteal artery, which is actually continuation of the the femoral artery, okay, in the posterior aspect of the ankle area, the popliteal area. Now, this one could be actually dilated. The diameter could be dilated, and that's what we call popliteal aneurysm. Okay, where there is dilatation of the diameter, yes, of the popliteal artery, so we call it popliteal aneurysm. Okay, so with this popliteal aneurysm, yes, what happens is that I told you that the fascia of the popliteal fossa, okay, is very tough and inelastic. As a result, if there is popliteal aneurysm, what will happen is that it may compress on the other neurovascular structures, okay, in the popliteal fossa. But importantly, I'm interested in talking about, because the tibial nerve is more medial than the common peroneal nerve, the common peroneal nerve may be spared, but the tibial nerve is likely to be affected. And when the tibial nerve is affected, then you know that, of course, muscles in the posterior compartment of the thigh will be weak, and it may lead to what we call weakened plantar flexion. So that's one thing that we have to actually know. Now, again, there could be inflammation. Now, I told you that deep to what we call the popliteus muscle, okay, will be what we call the popliteal bursa. Now, this bursa, through what we call some bacterial infections, it could actually result in inflammation. Now, when it inflames, and if it's not taken care, then it could rupture. When it ruptures, what will happen is that, yes, it presents with symptoms which are very common to that we find in the case of deep vein thrombosis, okay, clot in the deep vein. And some of these symptoms that you're going to see will be warmth, there will be heat, hotness around the area, there will be redness, of course, just showing inflammation, pain, in the calf area, So, ladies and gentlemen, I hope you find this tutorial helpful. Okay, we went through, the muscles of the anterior compartment, which we said they were actually the, flexors, okay, extensors, helping in actually dorsiflexion. We went through muscles in the lateral compartment, being those ones which are going to help in eversion actually. Then those ones, the posterior ones, going to be helping in what we call plantar flexion. And I hope you find it very useful. Please know the position so that in transverse sections you can actually appreciate them. May God richly bless you.